Hello everyone, this is Jipin here. I am going to introduce a new channel of mine, which is Mr. Nurse. So, you might be thinking why I have started this new channel. I have certain reason for to tell you. The first thing is that I have started this channel because of wanting to share some informations and important thoughts of mine to all of you. I'm very sure this will be useful for you in your coming future. You would also agree with me that there are a lot of issues in our nursing profession right now is going on. And as you are started working in hospital, or maybe you as you go to a new place, you will also understand what are the difficulties you as a nurse are going to face. At the same time, you also know that you wanted to go abroad for some reason, and we all know the reason for it, right? Some of you wanted to have a good salary in abroad, some of you wanting to have a good work culture and respect, also a good environment for setting up the family. So, looking from a nurse point of view, that's absolutely correct. But when we look at from a public person or a citizen of India, we feel that our best nurses are going abroad and our India are not getting qualified nurses. Don't you feel it's a sad situation for our nation? So it is important to accept those the nurses as the leader in the healthcare system. If we look at either the private and public hospitals in India, are majorly handled by the nurses, doctors, and other people comes after nurses. But when you look at any hospitals or nursing home or maybe any kind of bodies like a medical bodies or nursing bodies, everywhere the medical doctors are heading, and most of them are male doctors. So I'm trying to give you a simple a viewpoint of where the dominancy in the nursing profession comes from. Now you might be able to correlate the situation of what I've said it right now. And apart from that, there are also many instances that the hospital head, the medical doctor, are completely intervening into the nurses' issues, which is why our nurses are not able to express our problem or share our concern to the department. And also, when you look at the government segment, this is the same situation. I mean, the bureaucrats are not aware about what is nursing, and they still believe that the nurses are just the assistants to doctors for carrying their files, or just whenever the doctor feel frustration, just wanted to have somebody to shout on it or put blame on all the patients' errors and complaints on nurses. So apart from that, we as a nurses play a role in the health system, which I want you all to understand and which I want you all to carry forward. Unfortunately, our leaders, so-called nursing leaders, could not do much to our profession. That's the reason, even though our profession being the largest and the oldest profession, still we cannot reach up to a good mark in India. Whereas in Europe and America, we have reached the highest of the profession. It is because of the viewpoint of the nursing leaders where exist in their system. And we are still stuck up with how we can do the bed making in a better way. Whereas now in globally nurses are focusing on preventive treatment, then setting up on centers, nurse driven healthcare system. Where are our Indian nurses heading to? Are we going to be a just exporting material from India to different country, or are we the just a doctor assistant for Indian nurses? Give it a think on it, and let us discuss on this topic I would want you all to comment and suggest me what we need to focus on. I'm very sure we can do much bigger thing just from a small beginning. So let's begin this journey. Join with me in Mr. Nurses. We will take you all together a good life, a good career. Thank you all. A good luck.